My name is Megan Edwards, and I will be doing my report on respiratory therapists. Respiratory therapy is a profession in which you study pulmonary or breathing disorders, along with analyzing and performing diagnostic testing. They treat and work with patients with a variety of diseases or disorders that can vary from asthma to different types of lung diseases and also traumatic injuries that involve breathing in the lungs. They monitor their blood oxygen levels to ensure that there's adequate oxygenation throughout the body at all times, because poor oxygenation can lead to organ failure, organ shutdown, multiple life-threatening issues. And they also utilize cardiopulmonary machines and assisted breathing machines. Respiratory therapists work primarily in hospitals on vents. The ventilators are used for traumatic injuries and also patients who need to undergo serious surgeries in which they need to be put to sleep. The ventilators can only be changed, the settings can only be changed by a respiratory therapist. Therefore, there is always a need for a respiratory therapist throughout the hospital. On our next slide, we have our educational requirements. A minimum of an associate's degree is required to take the National Registry exam. Now, there is also a program for a bachelor's degree, and after the completion of either degree, a student may then take the National Board of Respiratory Care exam to become either a CRT or a certified respiratory therapist, which would be the first step in their certifications. And then from there, they can take another test for an RRT, or Registered Respiratory Therapist. There is a little bit of an increase in salary for an RRT, and it also allows for further certifications or specialties if you possess a degree as an RRT. On our next slide, we have our work environment. Most respiratory therapists will work in the hospitals on either an ICU floor or a surgical floor. Many times there are multiple ICUs and multiple step-down units to ICUs. So there is a great need for respiratory therapists in hospitals. They also work in home care for patients who have a chronic disease and need constant assistance or constant help with their ventilators, but do not need the attention of a full-time nurse in a hospital. They have been taught how to work all the machinery and what to do if something goes wrong, and they're allowed to live in their own. They are also in nursing homes for patients who, again, do not need to be in a hospital, but still need ventilators or other respiratory care devices. The shifts and the hours of a respiratory therapist vary. They can work full-time or part-time, and they also work all hours of the day and all shifts. They can work first through third shift. They can work 8-hour shifts or 12-hour shifts. It all depends on the hospital. And most times, like most medical professions, they will be required to work either weekends or holidays or both. On our next slide, we have our areas of specialty. These are just a few of the specialty areas. There are many, many different areas. The first would be the adult ICU, which would be from at least the age of 18 up to their geriatric patients or their older patients. This could be just working in a traumatic ICU area and dealing with traumatic injuries to surgeries. There's a wide variety of things you could deal with in an adult ICU. The cardiac ICU is another one. This would be where anyone who had heart surgery or a heart transplant or a heart bypass, anything of those areas, they would be taken to a cardiac ICU floor. From there, we also go to the pediatric ICU, which would be your patients from the age of anywhere between 2 to 3 to at least 15. These could again be chronic cases that you will see, or they could be traumatic injuries from any known number of sources. And finally, the neonatal ICU is where the premature babies or babies born with life-threatening illnesses or dysfunctions are sent as soon as they are born. They're held here for observation until they can be released, and sometimes they do need to be released with home ventilators. In this case, if you work in the neonatal ICU, you will more than likely need a higher certification to work with babies, meaning that you were specifically trained for this area of the hospital, because in this area, if a baby is sent home on any kind of respiratory care device, you will then need to also train the parents to ensure that they can properly work and function with the machine and know what to do in case of any kind of emergency. On our next slide, we have our salary. Now, there is a great variation in salaries between CRTs and RRTs all over the country. The median national average for a CRT is around $50,000. Now, this greatly depends on your location, as does every other number that I'm about to give you. The top 10% nationally is around $60,000, depending on your location. It all depends on where you live, what kind of environment you live in, and what area. Now, the salary for an RRT nationally is around $59,000 for a median, and the top 10% have around a $69,000 a year salary, depending on location again. It all varies. On our next slide, we have our advancement opportunities. There are many specialties and many areas in which you can specialize. There are also many certifications that one can gain after they have earned their certificate or have become registered. There are also supervisory and educator positions. There's great room for advancement. This is truly a ongoing and fulfilling position because there's so many options and so many things you can see on a different daily basis that make it truly remarkable. On our following slide, we have the future of this position. This position is expected to increase over 28% in the next 10 years. This will lead to an increase of over 35,000 positions nationally. With our society growing older as a whole, that will leave more older folks that will need to be taken care of and that could have pulmonary diseases or things of that nature that they will then need to have somebody to take care of them. So the position is looking really good right now and looking to increase. And our last slide in conclusion, this is a really growing position. There's promising outlook for students getting into this major and getting into this area, and it's a very versatile position. You can work in many different areas of the hospital and you don't have to specialize. You can work in pediatrics one day and an adult ICU the next day and cardiac the next day. There's many options for everyone. So this would be a very versatile position for someone who likes to change it up a little bit and likes to get out there. So this was my presentation on respiratory therapy, and I would recommend this to anyone who wants to get into the medical field, and it could truly be a good fit for anyone who loves to help people. Thank you.